Today, we have another interview in action from the conferences that just happened down here in Miami and Orlando. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. We want to thank our show sponsors who are investing in developing the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. Here we go. Okay, we're here from ViVE 2022, and we have Scott MacLean here with Medstar.
Yes.
Welcome to the show.
Thank you.
This is your first time on
the board?
Oh no, on the show.
Yes. Yeah.
We've done 500 interviews, so it's not a small thing anymore to say it's your first
happy
time.
to be with you.
Well, I'm looking forward to the conversation. So you've been at Medstar for about 4 years now.
Yes.
Give us a little of your background.
Sure. So electrical engineer, healthcare MBA, did an internship at Mass General Brigham when I was doing my MBA, and just ended up staying there over 21 years. Went through a series of leadership opportunities. Ended up as deputy CIO working for Jim Noga, and that was during the time that we were putting in Epic. And so when we wrapped that up, along with some big work on building an administrative building and finishing up Office 365, my last kid was graduating high school, and I decided to do a search for something else, and ended up at Medstar Health, which I've been happy about.
I mean, you just described that in like 30 seconds, but that's like 50 years of experience in a very short period of time.
Yeah, I was very fortunate. The time at Mass General Brigham, I was able to do various leadership jobs, including being CIO of one of the community hospitals there, and get the experience running the infrastructure there as we were building the Epic platform and implementing that. And we built a new data center, and as I say, a great experience in building our administrative building there that transformed the way that we worked from the administrative departments. Put 4,200 people into one building that had no offices. You could walk around the perimeter of every floor. We had great collaborative workspaces, and then I had left, but then pandemic hit, and I think they have a little different arrangement there now. So.
Yeah, everybody's talking about how things. What's top of mind at Medstar? You guys are a very innovative system.
Thank you. Yeah, we try to concentrate innovation. So that is under our Chief Innovation Officer, Bill Sheehan, who is a peer of mine, but we work very closely, and things that Bill likes to do, he runs on our technology infrastructures, and then we like to be quick about deploying them across the entire enterprise. And one example is the Telehealth Innovation Center is in his shop. And so like everyone else, we had very few per day when pandemic started. We peaked out at over 4,000 a day. And very quickly, that group was able to implement a solution that was pretty much one touch for the patient and one for the provider, and also created a test program that you could send out in advance so that the patient could test their audio and video and make sure it all worked too.
Well, that was one of the biggest things. When we looked at the studies and all the things afterwards, the number of calls that didn't connect was pretty high. The experience was not as clean, especially early on in the pandemic. I mean, we were throwing everything at it.
Sure.
So you guys stepped back and said, look, we're going to reduce that. Do you have like some metrics around how you guys were able to reduce those I guess disconnected experiences?
Yeah, I don't have them off the top of my head, Bill, but certainly if you're doing 4,000 a day, we got the ability for people to pretty easily connect and use the technology. We also used it for inpatient consults, and for when visitors couldn't come into the hospital, our nurses were able to help patients connect with their families via the same technology.
So you guys are DC area.
Yep, DC, Baltimore, Maryland.
Those are like two different worlds, aren't they, from a healthcare perspective? We've interviewed some people from Maryland, and they talk about their system and its reimbursement model is very different than the rest of the country. It's almost a foot in both worlds.
It's like many organizations that are dealing with both fee-for-service and value-based contracts, depending on where the payment's coming from. And it's happily a balance, because there is global payment in Maryland, and we have 7 hospitals there, 4 in Baltimore, and then others in Southern Maryland, Central Maryland. So there are different payer mixes in all of those places. And we're able to work with the state on that global reimbursement. And then in DC, there are also value-based programs there, but we're able to balance things out. And we're not-for-profit, so we're looking to have a margin to be able to make sure we have good bond ratings and can borrow the money we need to. But it's a thin margin business.
So I guess I would ask what's top of mind, but I'm more curious
like what's something that you guys have done in the last 2 years that you're pretty proud of, that you feel like, hey, we've really moved the needle here, and that we could share with the community?
Well, I mean, I think that what we've done that we're most proud of is what everyone has done in response to this, which is we've taken care of over 2 million patients per year in the Baltimore, D.C. region, and we think that we've done it pretty well. And a big effective tool in that is the EHR. Because the EHR was rolled out across all the hospitals and ambulatory sites, when we learned more about the disease and there were different screenings and interventions, order sets, ways of documenting things, we were able to do that universally through changing the EHR. And our folks worked very hard. I mean, all of our clinical folks, but also IT and other administrative folks to make that happen. So I think we're pretty proud of that. There's also, you say top of mind, I'm always talking about connectivity. So wired, wireless, cellular connectivity, shrouded in security, these are critical. We can have the best applications in the world, but if you can't deliver them, and end user devices, making sure that those are in working order. So we had to move a lot of equipment around. Everyone did, right? There were tents, there were testing, vaccination tents, new ICUs, various ways that we had to make sure that physical spaces were outfitted with the right equipment. And so really proud of the way that people moved for that. We also built out with the Army Corps of Engineers the DC Convention Center. We were the provider there. Fortunately, we never had to see any patients there, but it was a beautiful facility. It was put together in about 3 weeks.
Have you brought people back to work at this point?
So
back to work, back to the office.
Yeah. People are welcome under our policies, which are common around distancing and masking. We're aiming for early April we've set up all of our hoteling and hybrid workforce support. So we're looking for early April to bring that back and invite people to regularly participate in the hoteling program and spend time in the office.
So talk about your Chime service. So what's your role today?
So I was elected to the board last year, so the term started in January, a 3-year term. And most of what I've been involved with Chime recently is the policy steering committee. So we're about to have a session here explaining our policy advocacy and how that serves the membership. And I'm just happy to be part of the board, contributing, giving back. It's been a terrific experience so far. And you've heard the term 3.0 here as the organization's trying to transform and move towards more support of our digital health opportunities, analytics, and then Chime University. So.
Yeah, and it's interesting how much movement there's been on the policy side. There is an opportunity for CIOs and others to actually get in front of, not only on a national basis, but also on a state basis, because a lot of the rules and a lot of the policies are state-based. Is Chime helping to coordinate that activity as well, the state-based activity?
Our focus is really congressional and federal, and those rules are very complex, obviously, and it's not a part-time job. So we have staff in Washington that are working on responses to the commentary and those sorts of things. The team certainly, is knowledgeable about the processes. Obviously, every state's different, but we welcome questions from members about how they can get more actively involved in their state as well.
So congressional, cybersecurity obviously is big. Especially right now. Patient ID?
Yes.
I assume the 21st Century Cures has a lot of aspects to it as well. Are there other things that?
Yeah, we talked a little bit here about telehealth, so advocating for broadband connectivity, especially in rural areas, telehealth. We're often talking about how there are different parts of the care continuum that didn't get the high-tech funds for implementing EHRs, so looking for ways to help that continuum of care process and handoffs using interoperability.
Fantastic. Scott, I really appreciate your service at Chime. I mean, it's amazing this conference come together, and it's just fun to be back with everybody again. And I appreciate your time.
Well, it's great to talk to you, Bill. Thank you.
Another great interview. I want to thank everybody who spent time with us at the conferences. It is phenomenal that you shared your wisdom and your experience with the community, and it is greatly appreciated. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. Thanks for listening. That's all for now.